Reasons, causes, and risk factors. Lung cancer develops when abnormal cells in the lungs begin to grow uncontrollably, eventually forming tumors that interfere with normal breathing and the body's ability to exchange oxygen and carbon dioxide. In the United States, lung cancer remains one of the leading causes of cancer-related deaths. And while it is strongly associated with tobacco use, the reality is that many factors, some preventable and some not, play a major role in who develops the disease. The most common and well-documented reason is smoking. Cigarette smoke contains thousands of chemicals, including at least 70 known carcinogens, such as arsenic, formaldehyde, and radioactive elements like polonium-210. When a person inhales smoke regularly, these toxins damage the DNA of lung cells. Over time, as the damage accumulates, the cells lose the ability to die naturally and begin multiplying uncontrollably. This process can take years or decades, which is why many long-term smokers are diagnosed later in life. However, smoking isn't the only factor. Even exposure to secondhand smoke significantly increases risk. Living with a smoker or working in a smoking environment can raise chances of developing lung cancer by 20 to 30%. Children exposed at home also have higher long-term risks as their lungs are still developing. Another major cause is radon exposure. Radon is a naturally occurring radioactive gas that comes from the breakdown of uranium in soil and rocks. It seeps into homes through cracks in foundations, basements, and crawl spaces, especially in colder states where homes are sealed tightly during winter. According to the U.S. Environmental Protection Agency, EPA, radon is the second leading cause of lung cancer overall and the #1 cause among non-people living in older or poorly ventilated homes may be unknowingly exposed for years. Radon has no smell, color, or taste, so the only way to detect it is through testing. Many U.S. counties have high radon levels, and homeowners are encouraged to test their houses at least once every few years. Occupational exposure also plays a large role, especially for people working in industries with airborne toxins. Asbestos is one of the most dangerous substances linked to lung cancer. It was widely used in construction, shipbuilding, insulation, flooring, and manufacturing before its health risks became widely known. Even today, older buildings still contain asbestos, and disturbing these materials can release microscopic fibers that get lodged in the lungs. Other harmful occupational exposures include diesel exhaust, arsenic, chromium, nickel, cadmium, and coal smoke. People who work in mining, metal refining, construction, and chemical manufacturing face higher risks. Symptoms of lung cancer symptoms, can be subtle at first, often appearing only when the disease has reached an advanced stage. This delay is one of the reasons lung cancer is so dangerous. Early symptoms can easily be mistaken for common respiratory issues such as allergies, asthma, a lingering cold, or chronic bronchitis. In many cases, the initial signs are so mild that people dismiss them for months, unaware that cancer is developing. One of the most common symptoms is a persistent cough. This is not an occasional throat tickle, but a cough that stays for weeks or months, gradually worsening instead of improving. Smokers may call it a smoker's cough, but any change in intensity, frequency, or sound should be taken seriously. A cough that produces blood or even rust-colored sputum is a major warning sign and should never be ignored. Shortness of breath is another early symptom. People may notice they get winded more quickly while walking, climbing stairs, or performing simple daily tasks. This happens because tumors can block airways, reduce lung capacity, or cause fluid buildup around the lungs. Chest pain can also occur. This pain is often dull, aching, or constant rather than sharp, and it may worsen during deep breaths, coughing, or laughter. Recurrent respiratory infections such as pneumonia or bronchitis can also signal a developing tumor. This is not regular tiredness but a deep, persistent exhaustion that does not improve with rest. Many patients also report loss of muscle mass and general weakness. Lung cancer can also affect the voice. Hoarseness or a raspy voice may occur when a tumor presses against nerves controlling the vocal cords. Difficulty swallowing can develop if the cancer spreads to or presses on the esophagus. Pain in the shoulders, neck, or upper back may also appear when tumors affect nerves or nearby structures. Some people experience swelling in the face or neck due to compression of the superior vena cava, a major vein that carries blood from the upper body to the heart. This condition can also cause visible chest vein enlargement and is considered a medical emergency. Symptoms vary depending on the type of lung cancer. Small cell lung cancer, which is aggressive and fast-growing, often produces symptoms quickly and may cause hormonal or neurological problems. Because the cancer cells can release hormone-like substances, these substances can lead to low sodium levels, weakness, confusion, or muscle cramps. Non-small cell lung cancer, the more common type, grows more slowly but may remain silent until it becomes large or spreads. Treatment. Lung cancer treatment in the United States has advanced rapidly over the last decade, giving patients more options and better survival chances than ever before. Treatment depends on the type of cancer, non-small cell NSCLC or small cell SCLC, and the stage of diagnosis. A multidisciplinary team typically includes oncologists, pulmonologists, surgeons, radiologists, and specialized nurses who work together to create a personalized plan. For early-stage non-small cell lung cancer, surgery is often the first-line treatment. If the tumor is small and confined to one area, surgeons may remove only a portion of the lung, a wedge resection or segmentectomy. For larger tumors, a lobectomy, removing one lobe of the lung, is the most common procedure. In some cases, an entire lung may be removed, pneumonectomy, thanks to minimally invasive technologies like video-assisted thoracoscopic surgery VATS and robotic-assisted surgery. Recovery times have improved significantly. Radiation therapy is another key treatment, especially for patients who cannot undergo surgery due to age or other health conditions. This method has become a preferred option for early-staged cancers in patients who are not surgical candidates. Traditional radiation therapy is used for more advanced tumors or combined with chemotherapy to shrink cancer that has spread to lymph nodes. Chemotherapy remains an important treatment, especially for small cell lung cancer, which tends to spread quickly. Chemotherapy uses powerful drugs to kill rapidly dividing cells and is often used in combination with radiation or after surgery to eliminate any remaining cancer cells. While chemotherapy can cause side effects such as nausea, fatigue, and hair loss, modern supportive medications have made it more manageable for many patients.